Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to the Power of Positive Thinking. In episode 1, we really laid the groundwork for understanding how positive thinking transforms our practice. And not only our practice, but also our life. And in this episode, Dr. Erica Ramey and I are going to roll up our sleeves and really dive into more of the practical applications of what practicing positive thinking could and should look like. I want to really start our discussion, Erica, with effective techniques. What are some of those effective techniques for really cultivating a positive mindset?
Great question. I would like to start with its counterpart and first maybe discuss some things that are very damaging for a positive mindset and things that I think for many of us might come more naturally. So these are things not to do. I'd like to start with that.
Perfect.
First, let's just start with what we shouldn't do.
I need a pencil so I can write them down.
Write this down. So things that we know will make it very difficult to have a positive mindset. First, going ahead and jumping to conclusions. So if this happens, then this will definitely happen. And then the whole day is ruined. So sort of catastrophizing things, worst case scenario, going ahead and assuming the worst about other people. Well, so-and-so is not going to do that because she's just not like that. And she's just selfish. You just always worst case scenarios, very negative, jumping to conclusions. All of those things are the enemy of a positive mental framework. So let's just start by acknowledging that those things are destructive to positive thinking.
Right.
And so now that we know sort of what not to do with that approach, it helps us think a little bit more about what to do. So I think we mentioned in episode 1, assuming the best in others, especially in our coworkers or teammates. I think it's beneficial for our patients too, to assume that they, in most cases, do want to get better, that they are doing what they can with the resources that they have, and recognizing that there may be factors contributing to how they take care of themselves or do not take care of themselves that we may not be aware of. So we start by assuming the best in others. We start also by fact checking. So this is sort of the opposite of jumping to conclusions or worst case scenario. For fact checking, we take a step back and we say, well, wait a minute. Do I actually know that this bad thing's going to happen and then this bad thing's going to happen and then the whole day is ruined? Or am I just assuming that and sort of speaking it into existence? So we fact check a little bit. And so we take a step back and then we look at the things that are actually within our control. So what that is within your control, what that you have the ability to actually impact or influence, can you start with? So first and foremost, our attitude, right?
Yes, that's a big one.
Right. We can't choose all of our circumstances, but we absolutely can choose how we respond to our circumstances. And we can make things better for ourselves and coworkers, or we can make things harder for ourselves and our coworkers. So really kind of keeping stock of our attitude and being self-aware enough to recognize if we are contributing to the solution in a positive way, or if we are actually being destructive and making improvement more difficult. And that takes a lot of self-awareness. And sometimes it is hard to acknowledge we are part of the problem, or we are the problem for someone else.
True. And what you're saying about our reactions and having I teach my kids this, I teach my students this. At the end of the day, I am not responsible for how other people treat me or what they do, but I am responsible for my actions. And so just like what you're saying, I'm responsible for my thought process too.
Right. And our thought process will inform and shape how we respond and what our response is. So again, if we are thinking the worst about the person we're interacting with, that's going to show itself in the way that our body language,
my face,
our face
is not quiet. My face is loud.
Same. My face is having whole conversations with people without my permission. So it will you're not keeping your thoughts about someone else in as well as you think you are. It's coming out in tone. It's coming out in assumptions and the words that we choose. It's coming out in our body language. Even those of us who are maybe skilled and very practiced in trying to modulate that, I'm thinking, of course, mental health professionals, no one is perfect. So if we are thinking negatively towards our patient, towards our teammates, towards our family members, it will shape how the conversation goes, the words that we choose, whether or not we make progress. That's why that positive assumption that we've mentioned is so important. So yes, our face, we really have to watch the nonverbal body language for all of this.
Isn't it like 80% of our communication is nonverbal versus 20% verbal?
It's drastically high. And, you could argue different people, different personalities, and so that influences some of that. But people are paying attention to your tone, the words that you choose, but more so, do you seem open? Do you seem empathetic? Or do you seem like you're done with this conversation? You're not really listening. People notice. Absolutely.
Yes. Non-communication I think that is huge in all of our relationships. Our patients, it really affects how well they're accepting of us and how well they trust us. Our nonverbal communication, even with our spouses, our children, that is also misunderstandings and perceptions.
Yes. Yeah. Well, and again, if we are assuming the best about other people, we are less quick to jump to their intentions and thinking that we can judge their intentions when we only know our own motivation and intentions. But if we are thinking negatively towards someone or about someone, we're more likely to assume that they have negative intention, which is going to erode trust and make it very difficult to work as a team or to reach a solution together, because now you're pitted against the other person instead of working alongside the other person.
Very good. Working in healthcare today, the things that you're talking about, the techniques, how can we integrate that positive thinking, the techniques to help us get into positive thinking into our daily routines?
So this can be used from, again, like a top-down systems approach all the way down to like an individual conversation with a coworker. And what I love to see from leadership is a positive framework towards issues that they encounter, instead of viewing it as this is an employee issue or this is a personnel issue. If we can take a step back and see, okay, assuming my employees want to do a good job and assuming they're good, competent employees, and that's why we hired them, what can we kind of look at? How can we reframe this to see, is there an issue in our system for this that may have contributed to this error or to this problem or to this safety concern? So it can go all the way from leadership down to us having a conversation with our team for the day and how we're dividing patients and looking at it. Say you've got a coworker who doesn't want to work with, I think in episode 1, it was Miss Jones, who's been especially difficult. Poor Mr. and Mrs. Jones. And so instead of assuming, our coworker is lazy or never wanting to take responsibility, perhaps we can give them the benefit of the doubt. Maybe there's some countertransference with this patient, or maybe it's their 4th 12 in a row, and really they don't feel that they're in a good spot to provide the best care for this patient. And maybe we need to look at our system for assigning this person. Maybe we need to kind of rotate care so that we're all kind of sharing in
and not burn
the patient outcome. Exactly.
I mean, because it is true. I mean, you do have difficult patients. I'm not trying to say that we don't, but a lot of times the difficultiness that is passed along, it limits how often people will go in the room to help them, or how sincere they are about whether or not they wanted some pain medicine. It definitely affects patient care.
Well, and it also affects the patient's perception of the competence and compassion of the staff, which then in turn affects how the patient interacts with the staff, which then makes it more difficult for the staff. So it really just sort of spirals and makes the problem bigger than it started out because of kind of the negativity and the assumptions and just kind of passing that along.
Absolutely. And you usually see a nurse or two where they get along really well with the difficult patient. And now it makes me wonder, I just want to think back, I want to research it now. were those the ones that had a positive thinking? Maybe that was just built into their personality.
I mean, absolutely. It may have been, or they may just be good at benefit of the doubt, or perhaps that patient reminded them of someone that they have compassion towards, and they were able to kind of reframe the patient's needs with some empathy. Empathy plays a big role in that positive regard for people.
And I'll be honest, positive thinking is not built in automatically to my personality.
Okay, all right.
Like I that is something that I have to work on every day, is reframing my thought process, reframing my perceptions of circumstances and people. And I don't know. I mean, is positive thinking built into people's personalities, or is that really something that is learned? Or is it something that is learned where we automatically jump to the negative thoughts and negative self-talk, which then, we outwardly bring that forward?
That's a good question. And I would suggest, as with anything sort of mental health related, it can be both, right? Our personalities are somewhat innate. We are, to some degree, born with certain personality traits, but our environment and our upbringing certainly shapes that. So
Yes.
if you grew up with parents or guardians who were just unbelievably positive and empathetic and believing the best about other people, to some degree, it will be unavoidable for you to at least receive that mental framework. Now, whether or not you choose to use it, that's your choice, of course, but it's there. So you'll have that modeled for you, and it will be present. But it can be learned. So even if you didn't grow up with it modeled, it doesn't make you a lost cause. It can still be kind of nurtured and developed, and we can kind of we can work it to be more natural for us. I do think, though, for many of us, we are better at seeing other people's concerns or situations and being able to kind of work through that framework than our own. And so sometimes when I'm working with a patient, I may say, well, what advice would you give your friend or your loved one if they were experiencing or walking through what you're walking through? And oftentimes our insight is really better when we've removed it from our personal situation and we're able to be more objective. And so this is no exception. It's harder to see things clearly when it's our personal situation than it is if someone else were describing it to us.
It's that tunnel vision where we can only see what is in front of us versus taking a step out of the situation and looking at it and from a more broad perspective.
And taking some emotion out of it. There's usually a lot of emotion when it's us personally. Yes.
That's why I don't respond to negative emails. After I write them, I let them sit in my inbox for about 24 hours before
you hit send.
Yeah. Do I really want to say that, or do I just want to let it go? So yeah, that's definitely a practice I picked up. Especially teaching, because you get a lot of snippy little comments that
you do.
And so I just learned, you know what, I'm going to let that sit there for a while, and then I will come back to it when my feelings have simmered down and I'm more objective and not emotional.
Yes. And again, that's where teamwork can come in. I do a lot of team teaching. And if it's, a student where there maybe been a few more negative interactions, the ability to be self-aware enough to recognize I might not be the best faculty member to respond to this email, and working with your team without just passing on negativity, but saying, look, I want to make sure we're being positive and supportive for this student. I'm not maybe in the best place for that right now. Same with our patients. We're not always the best person to provide care. If we can recognize some countertransference, or maybe we are getting more frustrated with them, if we're noticing a change in our behavior that sort of cues us to there being some issues there, then maybe we work with our team and we pick up some area for them, and we allow them to provide the best possible care for that patient or for that student.
Yes,
because we're not perfect. We are
No.
people, and we are not checking our personal life at the door. That's not possible.
Mm-hmm.
So we need to be able to work with that while still having the best outcome for other people in mind and still having a positive mental framework. But again, it's not sticking our head in the sand, and it's not lacking self-awareness and pretending everything is great. I am unaffected. I am positive. That's not it. It's how can we approach this and find a solution that's beneficial. So it's a positive framework. It's not denial.
Because we are still affected. It still
Yes.
hurts or it still makes us upset, but it's giving ourselves time. Sometimes I do find myself sticking my head in the sand for a moment. It's almost time
Okay.
to, it's time to like think through and understand the situation and just giving myself a moment to step away. Maybe
Sure.
that's not really sticking my
That's
head in
not
the
not
sand,
at all. Not at
but
all.
it's because I'm not,
That's a pause so that you don't
yes,
respond emotionally. And
it's a
that's
pause
okay.
to my
As long as you're
pillow.
coming back. Yes. Sleep on it, right?
Yes, I'm going to
That's
pause to the
yes.
pillow. Um,
That's a sidebar, but that's really, really good advice for someone who might be struggling more with a positive mental framework. Many of us struggle more when we're tired with
mhm,
being positive. So I was having this conversation with my middle son just the other day. He was really feeling it. He was really feeling very negative, very sad. He was viewing a situation a little bit unreasonably. And so
mhm.
I encouraged him to sleep on it. I gave him a little bit of fact checking. I'm not sure what you're thinking is true. I'm not sure we have all the evidence we need to come to that conclusion, but I think you're also really tired. And of course, all our kids say, I'm not
I'm
tired,
not
right?
tired.
I'm not
Mhm.
tired. I said, maybe you're not, but every decision is a little easier when we're not tired. So let's go to sleep. Let's think on it. When we get up in the morning, let's revisit it. Well, of course, lo and behold, the next morning, oh, I think it was probably okay. I might have been overreacting. So if you are really struggling, don't make big decisions late at night. Don't send emails when you're tired. Don't in
Yes,
relationship, don't break up at 10
or
p.m. Like
in
just
your
wait,
feelings.
sleep on it. Exactly. Sleep on it. Let's revisit it when you're clearer, you're a little more rested, and generally more positive, truly.
And that really leads into my next question that I have for you is how can mindfulness and meditation contribute to positive thinking?
Right. Yes. So it's almost like what you just said when you kind of take a pause. So part
Mhm.
of mindfulness and being mindful is a pause, and it's not allowing our emotions or the situation or the stressor to kind of overtake our organized logical approach to thinking, right? It's a pause. Let me take stock of what I'm feeling. Why am I responding this way? What was it about the email that now
Mhm.
has my heart racing a little bit? Why am I feeling anger towards this person I don't really even maybe know that well, or this patient that I understand is clearly ill? Why am I feeling this way? What is going on? So, mindfulness allows us to take a pause, take stock of what we're thinking and feeling, address it if there's something that needs to be addressed. Maybe
Mhm.
they remind you of something or someone, or maybe it's not even about them. Maybe we're actually just still frustrated for something else that's going on over here, but that's caused a lower frustration tolerance. And now it's bubbling up over here. So, okay, well, let's acknowledge that. And then let's go back and revisit the situation. So, what is actually going on? What does this patient need? Or what is the issue in my team setting that we need to address? Okay, so positive regard for the people I'm working with, assuming we all have the best of intentions, what's the next best logical step? So mindfulness is kind of the root for all of that. So all of the positive thinking takes place in that space where we have allowed ourselves to pause and be mindful of the situation. So it's really that like the space or the box or the room in which the positive thinking can happen. So it requires us to be mindful to even begin thinking in that way and reframing, and it gives us the space to do that.
I really like that you gave mindfulness the term pause because my husband will say, you can't put your head in the sand, you know? He always, he's like,
Yes.
that's what you do. You put your head in the sand. And I can be like, I'm just taking a pause.
It's just a pause. I'm taking a
Just
pause so that we don't have to hit stop. I'm taking a
right.
pause. I'm taking a pause, which can be much better than fast forward, reverse, yeah, stop.
Right.
Yes.
Or
Just taking a
making
pause.
that wrong decision or that wrong
Yes.
interpretation and just giving you a moment to really rethink what happened or what you're feeling.
Mm-hmm.
Is that true? Most of the time, what I'm feeling is not true. I mean, a
Sure,
lot of times
sure.
it is, but most of the time it's because you've had things compounding one on top of the other. And then you have that extreme feeling like what you're talking about. That's probably not true of that particular situation. It's just because you've been bombarded by so many
Sure,
situations.
yeah. And it may be, our emotions, sometimes they run on very little information. So I would say they're ill-informed. So
Yes.
we want to inform our emotions of what the actual facts or evidence are, and then we can kind of process it out a little bit more logically. Sometimes our emotions mean well, they just don't have all the information.
Right. They're usually wrong in the
Yeah.
in the moment until you have
Sure.
all of the information. But maybe it's the brain's way of trying to protect you, but it's jumping
Sure.
ahead probably 5
Sure.
steps from where I don't need to be. But that's good. I really like pause. That is so
It's
good.
a pause. And you could even tell him you don't want to stick your head in the sand, but he is important to you, or the situation's important to you. So you want to pause so that you can make sure that you're very intentional in your next steps. So
That's really good too. Being
little
intentional.
reframing.
Yes.
Yes.
Instead of reactive, you're being
Mm-hmm.
intentional. And I think positive thinking, when you're trying to reframe, helps you be more intentional rather
Mm-hmm.
than more reactive, would you say?
Absolutely. Absolutely. And in a more constructive way as well.
Mm-hmm.
Absolutely.
What are some strategies to help with overcoming? Earlier we talked a little bit about the negative thoughts and the negative self talk that
Mm-hmm.
a lot of us struggle with, typically from probably environments that we grew up in. But what are some of the strategies for overcoming those negative things so that we are more acceptable in being able to use positive thinking?
Yeah, absolutely. So first, I'm a big supporter of therapy. If you find that
I had no idea.
yeah, I know. You would never guess. You would never guess. No, if you find that perhaps you're struggling more than the typical person, or if you see that perhaps it's confounded with depression or anxiety or things that make it a little bit more difficult to have a positive mental framework or have constructive, logical thought processes, then I really do recommend therapy. So we're speaking in kind of in terms of what would be normal or typical. But if anyone finds themselves just outside of that, working with a therapist or a psychologist to actually work on reframing how you view people and the world around you can be very, very helpful. And, you may be interested in DBT or even a CBT or just a problem focused therapy. But I really do recommend therapy if it seems like what you're struggling with is outside of the norm. So, having said that,
How do we know it's outside
right,
the norm?
sure. Okay.
I'm not sure.
Great question. Great question. So that's actually something I get asked a lot. So not every problem and not every disorder requires treatment. We look at the degree of impairment and the severity of symptoms. So if it seems that you're really struggling in personal relationships with reframing your thinking, and maybe you're really struggling in the workplace with positive regard for other people, or connecting with colleagues, if it really is causing problems in several areas of your life, then it's worth looking into if therapy might be beneficial at restructuring and reframing that. If in general you do pretty well, but it's a little thing here, a little thing there, that's what we're all doing our best. Okay, we're all doing our
Yes.
best, and we all have bad days and difficult areas for us. So if it seems like it really is causing significant impairment for you in different roles, then therapy is a great place to start. Again, having said that, my favorite sort of initial response is what they just call fact checking, and it's a therapy technique too, but it kind of keeps us from those automatic negative thoughts. So our initial thought may be, well, I read her email and she hates me and doesn't like any of my ideas. And so this isn't going to work at all. That she's not even trying because she doesn't like, and we just sort of start to spiral a little bit. Whereas the email may have just had a period instead of an exclamation mark. Right. So it's really more about us and our perception than is the other person and what they said. It's really more about how we are feeling about ourselves and about that interaction. So it really stems from us. Absolutely. It's our own insecurities on display.
Mm-hmm.
So for those instances, I just like fact checking. And that is just where we take a pause, right? We're mindful, we take a pause and we say, okay, what's my evidence that she hates me and we're never going to be able to work together as a team? So let me go back to the email. Let me look at it.
Mm-hmm.
Okay, she didn't actually say she hated me. So there's that. So then we just start fact checking. And basically, if it can't hold up to fact checking, we have to discard it. Okay, if we don't have any evidence to support it, we have to discard it. And sometimes we're good at fact checking. And then other times we might need someone we love and trust to fact check with us. Like, hey, honey, can you read this email? Does she hate me? And, husband reads the email and is like,
she does.
What are you talking about? I don't understand any of you, blah, 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 blah. So, fact checking. What evidence do I have to support this assumption I'm jumping to? Is it reasonable, or am I maybe projecting and kind of spiraling a little bit? So fact checking is probably the easiest, quickest way to catch an automatic thought. What evidence do I have? Do I actually know this to be true? So that's my favorite and the simplest. And the more we practice that, the better we get at catching ourselves very quickly. Oh, wait a minute. I don't actually know how this person feels about me. Maybe I'm off today and I'm reading their email I'm tired, and maybe I just had a little uncomfortable interaction with someone else and I'm bringing that into this. So let me just pause. Let me take her email for what it is. Let me respond appropriately, and then we'll go from there. So fact checking is definitely my favorite, hands down.
Now, when it comes to positive thinking in our patient interactions, how does it enhance our interactions and even the outcomes?
Absolutely. Sort of as in the example we mentioned earlier, if we think negatively about the patient, we may find that we start avoiding the patient a little bit, or maybe our body language gives off like, I'm here bringing you your medicine, but I don't want to be here.
Mm-hmm.
And it would be silly to think our patients are not picking up on that. So then they may underreport or not communicate their concerns or their pain. And then we may see, decreased or worsening outcomes for that patient. So there's direct and indirect issues. Similarly with a student, if we're working with a student and they feel like we're not approachable, they're not going to come to us with concerns. They very well may appeal the whole process and go over our head, but they're not going to feel comfortable approaching us with concerns. So really, we kind of erode trust. And when we see that breakdown of trust, we see that we can't work together as a team anymore. We're no longer effective. And so patients aren't going to tell us what they need. We're not going to be as receptive and observant to monitoring their needs or concerns. And then we can kind of just see decreased outcomes that stem from that.
And I will say that we are representatives of not only our unit, but also our hospital and organization, also our profession.
Yes.
And so when we erode the trust of a patient, then that patient starts to not trust the unit,
right,
the hospital, and then it moves to our profession.
Absolutely.
They might not even seek, further care at their clinic because, healthcare workers don't care about me. It's terrible. I can't trust them. And so I really see that unfortunately we carry it is a heavy load of all of the people and all the organizations that you represent every time you walk into a patient's room.
Absolutely. Absolutely. And nurses are the most trusted healthcare professionals. We don't want to trade that in.
No, we don't. Not at all.
We earned it rightfully so.
Yes.
And I read an article maybe a couple years back that was discussing how physicians on average are judged according to their own personal behavior. So one physician may act inappropriately and we attribute it to that one physician. Whereas with nurses, a nurse may act inappropriately or commit some sort of crime, and then we tend to excuse our view of nursing as a whole or nurse practitioners as a whole. So we really do carry the weight of our profession a little bit differently than some other healthcare providers.
Absolutely. So as we are running out of time, we've talked about what is positive thinking. We've talked about strategies for positive thinking. What do you want the listeners to really remember as we close out the series?
I think I would summarize some of what we've talked about in these episodes as, again, we're not talking about positive toxicity. I didn't say that right. We're not talking about just sticking our head in the sand and pretending everything is okay and sort of going for that sort of effect. We're talking about choosing to believe the best about other people and to view problems from more of a systematic or systems approach rather than an individual is flawed or something's wrong with this person approach. Taking a pause, take a beat, if you will, and give yourself some time to reflect on what you're bringing to the situation and then reframing the problem with more of a solution focused approach. Like how can we make this better? And using that as our positive mental framework. That's my takeaway. What's your takeaway?
I have a lot of takeaway.
Okay.
I always learn so much whenever you're here. So thank you so much for just coming and just sitting here with us to help us understand positive thinking. And so some of my takeaways from just talking with you and positive thinking is the research really is clear that when we cultivate a positive mindset, we do see improved patient outcomes, stronger therapeutic alliances, which is what we were just talking about, is how we carry the whole profession of nursing on our shoulders. And we also see reduced burnout rates within our profession. But beyond just the statistics, we've witnessed the human impact where there's a renewed sense of purpose in our work. We can create deeper connections with our patients and with our coworkers. And then just an enhanced resilience. I use the term resilience a lot today in facing our clinical challenges. But I do also really want to highlight again something we highlighted earlier, that embracing positive thinking doesn't mean just ignoring difficulties or maintaining unrealistic optimism. That's
Absolutely.
We can't carry that. So instead, reframe positive thinking to be more about developing a balanced, resilient perspective that serves both us and our patients better. It's really nurturing our own positive mindset so that we become better equipped to guide others towards healing and growth. What do you think?
I could not have said that better myself. That was so beautifully stated. Amazing.
Thanks. I know. I was like, how can I bring all of this together? So,
crushed it.
Yes. So to our listeners, as you continue your professional journey, I really encourage you to take time to revisit these episodes whenever you need inspiration or practical guidance or some laughs, because we have some laughs in here too today. The tools and strategies that Erica has discussed are really a great to have in your toolkit to help you with maintaining resilience and effectiveness in your practice, because your mindset matters, not just for you, but for every life that you have the privilege to touch in your practice.
Oh, I like that privilege. That was the gratitude there. Well done. Well
Yes.
done. Good modeling.
Thank you so much, Erica, for spending time with us. I love your willingness to educate and encourage other healthcare professionals, because positive mindset really is, it can be a struggle to learn how to do it, but it's so worth it when it becomes a habit.
Absolutely. Well, thanks for having me.
Yes. To our listeners, I encourage you to explore many of the courses that we have available on elitelearning.com to help you continue to grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.